Before any blood test, doctors provide specific instructions: fasting hours, water intake, medication adjustments, or lifestyle restrictions. These guidelines are not optional. They are carefully designed to ensure results reflect your true health condition. Unfortunately, many seniors either forget, misunderstand, or underestimate the importance of these directions. Ignoring them often leads to inaccurate results, which can cause unnecessary panic, wrong diagnoses, or even incorrect treatments. For example, if a doctor instructs you to fast for 10 to 12 hours but you eat a late-night snack, your glucose and cholesterol readings may come back higher than they really are. This might lead your doctor to think you have uncontrolled diabetes or worsening heart disease. Similarly, failing to avoid alcohol when instructed can raise liver enzymes and triglycerides, making it appear as though your liver or heart is in poor condition. Medication instructions are another area where mistakes happen. Some medicines, like blood thinners, statins, or certain supplements, must be paused or timed carefully before testing. Ignoring these directions may distort kidney, liver, or clotting reports, confusing the results. On the other hand, stopping medications without your doctor's advice can also be dangerous, as it may destabilize your health. Even seemingly minor details, like whether you drank enough water, had caffeine, or smoked, matter greatly. Doctors often explain these in advance, but seniors sometimes assume that a little won't hurt. In reality, small slips can have a big impact. For instance, not drinking water before a test can make your veins harder to access and can falsely elevate kidney markers. A cup of coffee can temporarily raise blood sugar and blood pressure, giving misleading results. The danger of ignoring instructions isn't just about numbers, it's about consequences. Inaccurate test results may lead to repeat testing, unnecessary prescriptions, or delayed treatment of actual health problems. For seniors managing multiple conditions, this increases both stress and risk. The best approach is simple: always ask your doctor or lab technician for clear, written pre-test instructions and follow them exactly. If you are unsure, never guess, call your healthcare provider to confirm. In short, doctors' instructions before a blood test are your roadmap to accurate results. Ignoring them puts your health at risk, while following them ensures your test reflects reality, helping doctors make the best decisions for your care. Many seniors underestimate the impact of smoking or chewing tobacco before a blood test. While it may feel like just a small habit, tobacco use, even hours before testing, can significantly change how blood markers appear, leading to misleading results. Doctors, particularly cardiologists, strongly advise against using tobacco products before lab work because they distort oxygen levels, circulation markers, and even cholesterol readings. When you smoke, the body takes in carbon monoxide, which binds to hemoglobin in red blood cells. This reduces the blood's ability to carry oxygen. During a blood test, this can make hemoglobin and hematocrit levels look abnormal. It may falsely suggest that you have anemia, poor oxygenation, or even lung-related issues, when in fact the values are influenced by recent smoking. For seniors already under observation for heart or respiratory conditions, this can be very misleading. Smoking also affects the vascular system by temporarily constricting blood vessels. This reduces blood flow, raises blood pressure, and can change readings for heart health markers. Tests that measure clotting ability or circulation efficiency may suggest problems that don't truly exist, simply because of a cigarette or two before testing. Chewing tobacco creates similar issues. The nicotine absorbed through the mouth rapidly enters the bloodstream, raising heart rate and blood pressure. It also increases stress hormones like adrenaline, which may alter blood sugar levels and certain cardiac markers. For seniors being tested for diabetes or heart disease, this can cloud the accuracy of results. Another hidden effect is on cholesterol and lipid levels. Research shows that nicotine and other tobacco chemicals can temporarily increase fatty acids in the blood, making cholesterol or triglycerides appear higher than normal. This could cause a doctor to believe your heart risk is worsening, even if your long-term control is stable. For the clearest results, it is recommended to avoid smoking or chewing tobacco for at least 12 to 24 hours before a blood test. This allows the body to return closer to its natural state, ensuring oxygen levels, circulation markers, and lipids are measured accurately. In short, a single cigarette or tobacco chew before a blood test can hide the truth about your health. For seniors, avoiding tobacco use beforehand is essential to prevent misdiagnosis, unnecessary worry, and incorrect treatments. Most seniors know the importance of diet and medicine before a blood test, but few realize that stress and poor sleep can change results just as much. Doctors often warn that emotional strain and restless nights can temporarily raise or lower certain blood values, creating a false picture of health. This is especially important for seniors, whose bodies are more sensitive to hormonal changes. When you are stressed, your body releases cortisol and adrenaline, also known as stress hormones. These chemicals prepare your body for a fight or flight response, but they also interfere with blood test accuracy. Cortisol, in particular, raises blood sugar levels by stimulating the liver to release glucose. This means if you walk into a fasting blood test after a stressful night, your glucose results may appear higher than they actually are, suggesting poor diabetes control. Stress also affects cholesterol and triglycerides. Studies show that mental or emotional strain can increase the breakdown of fats in the body, releasing fatty acids into the blood. For seniors already under observation for heart disease, this can make cholesterol readings look worse than they really are, leading to unnecessary medication adjustments. Lack of sleep has a similar effect. A single night of poor rest can raise inflammatory markers, such as C-reactive protein, CRP, which doctors use to measure heart disease risk. Sleep deprivation also disrupts insulin sensitivity, causing higher blood sugar levels during testing. Seniors often underestimate how much one bad night can make lab results appear abnormal. Another overlooked issue is blood pressure and heart markers. Stress and sleeplessness raise heart rate and blood pressure, which may influence tests related to cardiac enzymes or kidney filtration rate. Doctors may interpret these spikes as a sign of worsening heart function, even if the problem is only temporary. To avoid these errors, seniors should aim for a calm evening and restful sleep before any scheduled blood test. Simple practices like light reading, avoiding late caffeine, gentle breathing exercises, or listening to soothing music can help the body relax. If anxiety about the test itself is an issue, try scheduling it early in the morning to reduce waiting time and worry. In short, stress and lack of sleep don't just make you feel tired, they directly affect blood results. For seniors, managing calmness and rest before a test ensures that reports reflect true health, not temporary imbalances. Hydration plays a crucial role in the accuracy of blood test results, yet it is one of the most overlooked factors, especially among seniors. Many older adults either don't drink enough water before a test or rely too heavily on tea and coffee, thinking they count as hydration. In reality, both dehydration and excess caffeine intake can significantly distort blood readings, particularly those related to kidney function, electrolytes, and overall heart health. When the body is dehydrated, blood becomes thicker and more concentrated. This raises values such as hemoglobin, hematocrit, and red blood cell counts, making it appear as if you have a blood disorder or dehydration-related illness. Kidney function tests, such as creatinine and blood urea nitrogen, BUN, are also highly sensitive to hydration status. If you are dehydrated, these numbers rise, giving the false impression of impaired kidney function. For seniors already being monitored for kidney disease, this can cause unnecessary alarm and additional testing. Caffeine complicates the issue further. While coffee or tea may give a temporary energy boost, caffeine is a diuretic, which means it makes the body lose water through increased urination. Drinking too much caffeine before a blood test can lead to mild dehydration without you even realizing it. This, in turn, alters electrolyte levels like sodium and potassium, which are crucial markers for heart and nerve function. A small imbalance might not be serious, but test results can exaggerate the problem, making it look as though your heart or kidneys are under strain. Caffeine also affects blood sugar and blood pressure readings. A strong cup of coffee before a fasting glucose test may cause a sudden spike, hiding your true baseline. Likewise, caffeine can stimulate stress hormones such as adrenaline, which temporarily raise blood pressure and other cardiovascular markers. For seniors being closely observed for heart health, this can give doctors misleading information. The best preparation is simple: drink enough plain water, about 1 to 2 glasses, before your blood test. This keeps the blood volume normal, ensures veins are easier to access, and gives the most accurate reading of kidney and electrolyte balance. Avoid caffeinated drinks. Medications are essential for managing health, especially for seniors who often take multiple prescriptions daily. However, many people don't realize that some medicines can interfere with blood test results, giving false highs or lows that confuse doctors. Heart specialists and general physicians repeatedly warn older adults to check with their doctor about which medications should be paused before a test, because even one missed instruction can change the entire report. For example, cholesterol-lowering drugs, statins, can alter liver enzyme readings. If a test is being done to evaluate liver function, continuing statins right before the test might make it look as if the liver is struggling, even if it's healthy. Similarly, diuretics, water pills, commonly prescribed for blood pressure or heart problems, affect sodium, potassium, and kidney function values, sometimes leading to a false impression of dehydration or kidney disease. Another common case is blood-thinning medication, such as aspirin or warfarin. These drugs don't just affect clotting times, they may also influence liver and kidney test results. If a doctor isn't aware the medication was taken right before the test, they may assume there's a problem when the reading is simply drug-related. Even over-the-counter medicines and supplements can interfere. Vitamin C, for example, can distort glucose readings, while biotin, a popular hair and nail supplement, can interfere with thyroid tests. Seniors often take multivitamins, herbal remedies, or natural supplements without realizing they can significantly alter lab results. It's important to note that not all medications should be stopped. Some, such as those for heart rhythm, blood pressure, or insulin for diabetes, may be dangerous to skip. That's why the key step is communication with your doctor. Before your blood test, always provide a full list of medications, including over-the-counter pills and supplements, so your healthcare provider can decide what to pause and what to continue. Experts usually recommend taking medicines after the blood sample is drawn, unless your doctor says otherwise. In many cases, simply adjusting the timing is enough to avoid misleading results. In short, medications are life-saving, but without careful planning, they can cloud blood test accuracy. For seniors, always double-check with your doctor about what to pause, what to continue, and when to take your pills. This ensures that test results reflect your real health, not the influence of medication. Exercise is usually a powerful tool for good health, but doing it right before a blood test can be a major mistake, especially for seniors. While staying active is crucial for heart health, overexercising just hours before your test can cause spikes in certain enzymes, hormones, and metabolites that make the results appear abnormal. Doctors, particularly cardiologists, often warn older patients that intense physical activity can mask or mimic disease symptoms in blood work. One of the biggest issues is the release of muscle enzymes, such as creatine kinase, CK, and lactate dehydrogenase, LDH. These enzymes rise naturally after strenuous exercise because the muscles are repairing tiny tears. However, the same enzymes also rise in serious conditions like heart attack or muscle disease. If a senior does heavy exercise before testing, their results might falsely suggest muscle damage or heart stress, leading to unnecessary further tests or anxiety. Another problem is blood sugar fluctuations. Exercise uses glucose for energy, which can temporarily lower blood sugar levels. In someone being tested for diabetes, this might create the illusion of good control, hiding the true state of their condition. On the other hand, very intense workouts can trigger stress hormones like cortisol and adrenaline, which raise glucose, giving the opposite false impression. Both extremes distort the real picture of your metabolic health. Cholesterol and triglyceride readings can also be affected. After vigorous activity, the body temporarily mobilizes fats for energy. This shift can lower triglycerides or alter lipid levels in ways that don't represent your everyday baseline. For seniors closely monitored for heart disease, such distorted results can mislead doctors into thinking your heart health is better, or worse, than it actually is. Moreover, heavy exercise just before a test can cause temporary dehydration. Sweating reduces plasma volume, which makes the blood more concentrated. This can falsely elevate certain values such as hemoglobin, hematocrit, and electrolytes, raising concerns about kidney or blood disorders that may not actually exist. To ensure accuracy, experts advise avoiding strenuous exercise for 24 hours before blood tests. Light walking or gentle stretching is fine, but weightlifting, jogging, cycling, or anything that leaves you breathless should be postponed until after the test. In short, overexercising before a blood test confuses the results, creates false alarms, and risks misdiagnosis. For seniors, it's far better to rest, hydrate well, and let the test reflect your true health condition. Alcohol is one of the biggest silent disruptors of blood test results, especially for seniors. Many people assume that having a glass of wine or a small drink the night before won't matter, but even moderate drinking can alter critical readings. Heart specialists consistently warn older adults that alcohol can mask or exaggerate signs of disease, leading to misdiagnosis or unnecessary treatment changes. One of the main ways alcohol interferes with blood tests is through its impact on liver function. The liver processes alcohol, and when it's busy doing that, enzyme levels such as ALT and AST may temporarily rise. If you have a liver test the next morning, it might falsely suggest liver inflammation or damage. Seniors already face a higher risk of liver strain due to age and medications, so alcohol consumption before a test makes it difficult for doctors to assess the true state of the liver. Alcohol also directly affects cholesterol and triglyceride readings. A single night of drinking can raise triglycerides dramatically, making it appear as if you are at higher risk of heart disease than you actually are. This is especially concerning for older adults being monitored for heart health, because an artificially high lipid profile may push the doctor to recommend stricter diets, extra medications, or even unnecessary procedures. In addition, alcohol can disrupt blood sugar levels. Depending on the type and amount consumed, it can either spike or lower glucose, leading to confusing results. For seniors with diabetes or prediabetes, this can be dangerous because it hides the real trend of blood sugar control. A normal reading influenced by alcohol might delay treatment, while a false high might create panic. Another hidden danger is alcohol's effect on hydration. It acts as a diuretic, causing the body to lose fluids. Dehydration thickens the blood and alters electrolyte balance, which can interfere with kidney function tests. Seniors, who are more vulnerable to dehydration, may unknowingly walk into the test already skewed, giving results that don't reflect their natural condition. For the most accurate reports, doctors recommend avoiding alcohol at least 24 to 48 hours before any blood test. This gives the body time to clear it completely, allowing the liver, kidneys, and heart to settle into their true baseline state. In short, alcohol may be enjoyable in moderation, but before a blood test, it is a hidden enemy. Avoiding it ensures reliable results, accurate diagnoses, and safer medical decisions, especially crucial for seniors monitoring heart and liver health. When doctors ask you to fast before a blood test, it is not a suggestion, it is a medical necessity. Fasting means avoiding all food and drinks, except plain water, for a set period, usually 8 to 12 hours. This helps your body reach a natural baseline, allowing doctors to see your true sugar, cholesterol, and fat levels. Unfortunately, many seniors unknowingly break the fasting rules, leading to distorted results that can confuse even the best heart specialists. One of the most common mistakes is eating a small snack, such as a biscuit, fruit, or candy, thinking it's just a little. But even a tiny bite can raise blood sugar, spike triglycerides, and alter cholesterol numbers. This gives the impression of diabetes risk or poor heart health when, in reality, the numbers are artificially inflated. For seniors, who are already closely monitored for these conditions, this can lead to unnecessary medications or stress. Another fasting error is drinking anything other than water. tea, coffee, juice, or even milk all contain compounds that affect blood sugar and lipid readings. Caffeine, for example, may stimulate hormones that interfere with accurate glucose measurement. Seniors often underestimate how much just 1 cup of tea can skew results. Similarly, chewing gum or sucking on lozenges, even sugar-free ones, triggers digestion and disrupts the fasting state. Timing also matters. If you fast too long, say 14 to 16 hours, the body starts breaking down stored fats for energy. This can elevate certain markers like ketones and free fatty acids, making your results look abnormal. Seniors with weaker metabolism may also feel faint, dizzy, or fatigued with overfasting, which puts additional stress on the heart. To avoid these pitfalls, always clarify with your doctor how many hours you need to fast, usually starting from bedtime the night before. Stick to plain water, avoid chewing gum, and do not take just one bite of anything. Proper fasting ensures the test reflects your true health condition, helping your doctor give accurate advice and prevent misdiagnosis. In short, a disciplined fast is one of the simplest, yet most powerful steps seniors can take to protect their heart, manage diabetes, and ensure their blood tests reveal the real story of their health.